this afternoon. Today's talk is going to be on the biology of stress. So my name is Nicole, and today we're going to be going through the different causes of stress, the different types of stress, and the effects stress can have on the body. So starting off, like always, we'll start with a territorial acknowledgement. So I just like to acknowledge with respect to the Kwanghan peoples on whose traditional territory the University of Victoria stands, and the Songhees, Esquimalt, and Wasanich peoples whose historical relationships with the land continue to this day. And just another note here, I know quite a few of you have done our optional survey, but just to plug again, if you haven't yet done the survey for this series of talks, if you're thinking you might want to come to 6 or more talks out of our 9 talk series this year, please consider filling out the survey. It would really help us out. If you've already filled it out, that's great. You don't need to do it again. I'll just pop the link. Let me see if I can post it here into the chat. Here's the link to the survey. And as you can hear, this talk is going to be recorded, and it will be posted to Dr. Gair's website where all our other talks are. And the link to that website was in the email that you got the link for this Zoom today. And a couple more disclosures. So I'm a second-year medical student, and as such, this talk is just intended for your entertainment and a little bit of education, and it's in no way meant to replace the advice from your physician or any other healthcare professional. And all pictures I use here are either free stock photos, photos available under a Creative Commons license, and if they're not, then I cite them as well in the presentation. So thanks for joining us, and we'll get started. The agenda today will start out with a little bit on what stress is, the epidemiology or some statistics around stress, the different types of stress, the stress response pathway, so how stress leads to changes in our body, and the effects of stress, both acute, which we'll do before the intermission, and then chronic, which we'll do after the intermission. So if you have any questions, feel free to post them in the chat throughout the talk, and I'll try to cover them after we come back from the break. And then again, right after the intermission at the very end, you can put your mic on if you have any questions you wanted to ask. And then after the break, we'll talk mostly about the effects of chronic stress. That will be the majority of our talk. Then a little bit about when to seek help and a preview on stress management, which will be our talk for next week. Okay, so getting started here, what is stress? So stress is a feeling of emotional or physical tension, and it can be caused from physiologic stressors. So those are things that put a strain on our body, for example, injury or extreme temperatures. And there's also stress that can be caused by psychological stressors. So that's really anything that we interpret individually to be negative or threatening. So this could be events, situations, people, or comments, basically anything that anyone could interpret as stressful. And so from here on out, we're going to be talking about psychological stress. And now the definition of psychological stressors is pretty broad because we're all individuals and we can feel stressed out by different things throughout life. But research has shown that there are 4 common elements to all stressful situations that can lead to psychological stress. So the Center for Studies on Human Stress, which is a Canadian organization, has noted the recipe for stress is quite universal. So for a situation to be stressful, they say it must contain 1 or more of these common elements, which are summarized in the acronym NUTS. So it either has to include novelty, something new that you haven't experienced before, unpredictability, something that you had no way of knowing would occur, a threat to the ego, so your competence as a person is called into question, or it must impact your sense of control, meaning you feel that you have little or no control over the situation. And they've also noted that the more ingredients you have in one given situation in your life equals the more stress you experience. So what we've all been going through these past couple of years is a great example of a combination of stressful ingredients. We've got the unpredictability of COVID-19, the loss of sense of control, and the novelty, because most of us have never experienced such an impactful and isolating event. So talking a bit about the epidemiology or some statistics surrounding stress, Stat Canada survey in 2020, one of the things they looked at was on the perceived life stress people experienced. So they found that 20.4% of people reported most days are quite or extremely stressful. And this was found to be highest among those aged 35 to 49 at about 27.5% of people, or lowest among those aged 65 plus at about 10.3%. And one of the theorized explanations for this discrepancy is that people in the 35 to 49-year-old age bracket are often in the workforce with more responsibilities. They may have children and aging parents to look after, while those 65 plus are often retired, although not necessarily, and may have fewer responsibilities or stressors in their day-to-day life. So our first poll here, just to see if you guys are all awake, what is the most common source of stress in people's day-to-day lives? Do you think it's financial concerns, family, work, or time pressures, or not having enough time? So let me just open this poll here. Okay, so you should be able to select your answer there. And I'll give about 10 more seconds for those who want to respond to do so. Okay, so thank you for your responses. I'll end them here. I'll share the results. So most of you thought that it was either time pressures or not enough time. That was the most common source of stress, followed by financial concerns. So I'll stop sharing here. And you can click the little red X on the top of your screen if the poll's still up for you. So the answer is actually work. So that same Stat Canada survey in 2020, when they looked at the main source of stress in people's day-to-day lives, they found work was the #1 complaint as to the source of stress that people experience. In second was financial concerns. Third was family. And fourth was time pressures or not enough time. And the order of these stressors was the same among some other American studies that I came across. So it seems to be pretty stable across North Americans that work is the #1 source of stress in their day-to-day lives. And now recent events have only added to these day-to-day stressors that people generally experience. So there have been many different studies recently trying to estimate the burden of COVID-19 pandemic on individuals. One of which I found was the Stress in America 2020 study on COVID-19. And they found that Americans have been profoundly impacted by the COVID-19 pandemic, and factors that people previously reported as sources of stress in their life remained problematic throughout the pandemic. And this really led to some compounded stress that people were experiencing. So shown here, they found that 78% of people say the pandemic is a significant source of stress in their life. And 67% of people experienced increased stress over the course of the pandemic. And one of the quotes from this study, which I found really impactful, was, "We are facing a national mental health crisis that could yield serious health and social consequences for years to come." And I found this quote really relevant to our talk today, as it's alluding to stress having long-term impacts on the body. So in the Stress in America 2021 study, they looked at COVID-19 and decision-making, and they found that 63% of adults agreed that uncertainty about what the next few months will be like causes them stress. And this is understandable. I felt this myself. I'm sure many of you did, not knowing what was going to happen with restrictions and being able to see family and other plans you have. They also found that 49% of adults said the pandemic makes planning for the future feel impossible. And younger adults, especially millennials, who are most commonly in their 30s and may be at quite milestone points in their life or at the point of big life changes, feel this way. And finally, 61% of adults that they surveyed agreed the pandemic has made them rethink how they were living their life. And there isn't any follow-up to this question regarding it being a positive or negative thing, but I'd like to think that it relates maybe to people thinking, what's most important in their life and possibly reprioritizing their life based on that. So our second poll, true or false, all stress is bad. So let's pull this up here. Okay, so all stress is bad. Do you think that statement is true or false? Okay, and just 10 more seconds here to answer. All right, so I'll end the poll here. And it looks like the vast majority of you who answered thought that statement was false. Stop that there. Which is the correct response. So not all stress is bad. Stress can be categorized in many different ways, one of which is looking at eustress or positive stress versus distress, which is negative stress. So eustress is a positive stress, and fortunately, it's the most common type of stress that we face. Eustress results in short-term changes in the body, often while the stressor is present, and it doesn't have any long-lasting negative impacts. It may even have positive impacts, as it's theorized that eustress is needed for healthy development of our stress response system, as it teaches our body how to respond to stress in a healthy way. So an example of this would be performing in front of people, like public speaking or writing an exam. Distress, on the other hand, is negative, and it does have a greater impact on the body than the more everyday stress like eustress that we experience. And it can potentially lead to long-term negative consequences for our mental and or physical health. So there's two types of distress. There's acute or episodic, which is short-term and affects us in a negative way, like the death of a loved one or experiencing a breakup in a relationship. And there's also chronic or toxic stress, which is a long-term stress and the most dangerous type of stress for our bodies, an example of which would be abuse or addiction. So next, we're going to go through the stress response system, so how our bodies react to stress. And the stress response is mediated by two different systems. There is the fast response system, shown here on the left of the diagram, or the sympathetic nervous system. And then there's also the slow response system, which is on the right, which is called the hypothalamus pituitary adrenal axis, or HPA axis. So the fast response system on the left here is a response of our autonomic nervous system that runs through our brain and spinal cord, leading to the release down here of epinephrine or adrenaline. And it's triggered right away in times of stress. It's a very fast response. Whereas the slow response system on the right here, the HPA axis, is an endocrine or hormonal pathway that leads to the release of cortisol, which is the main stress hormone in our body. So this system's triggered a little bit later on in the stress response, and it also takes a bit longer time to elicit its effects. And this is just another look at the overall system, which I thought was a good summary of not just where the pathways act in our bodies, but what the end results are, which is shown in this purple box at the bottom. So just to explain a little bit about what's going on here, the sympathetic nervous system, or that fast response on the left, starts in our brain, and it sends a signal down our spinal cord, and one of the organs which it connects to is the adrenal gland, which sits on top of our kidneys. And when the adrenal gland is stimulated by the sympathetic nervous system, it releases adrenaline or epinephrine, and this contributes to our fight or flight response, which I'll go into in a moment. The HPA axis, that slower response system, also starts in our brain by releasing a hormone called CRH from the hypothalamus. And this starts a cascade of hormonal messengers that result in the release of cortisol, again from the adrenal gland, which sits on top of the kidney. And this contributes to changes in our metabolism and more long-term effects. So looking a little bit more closely at the sympathetic nervous system, this picture demonstrates the main organs it talks to and the effects it has. For example, some of the main effects are increasing our heart rate, increasing our blood pressure, enhancing our general arousal, and reducing gut motility, aka slowing down our digestion. And the general purpose here is to get our body ready for a flight or fight response. from any potentially dangerous situations. So the effects it has on the body support what we would need to do that. We need to dilate the pupils so more light can get in and we can see our surroundings better. We need to slow down digestion so that the blood can be prioritized to more important areas for the situation, like our brain and our muscles. And we need to increase our heart rate and our breathing so we can get more oxygen to our body, since running and fighting make us work hard. Now, when you're looking at the HPA axis, when your brain is stimulated by stress, it will respond by secreting the CRH hormone from our hypothalamus, which starts to activate the stress response system. This creates a chain of events releasing other hormones like ACTH from our pituitary, which then goes to act in our adrenal glands, stimulating them to release cortisol. Now, cortisol has various physiological effects, including promoting the release of epinephrine or adrenaline, which kind of feeds back into that sympathetic nervous system response we just talked about. It also has been shown to suppress parts of the immune system and mobilize energy stores so that we have more energy to use during a stressful encounter. So looking at this mobilization of energy stores in more detail, it does this by quite a few different methods, but a couple I'm going to highlight here are promoting the release of glucose from the liver, which counteracts insulin, the hormone in our body that lowers blood glucose. And it promotes lipolysis, aka the breakdown of fat. So these actions release energy stores into usable forms to aid us in responding to whatever stress we're encountering. So what are the experienced effects of all these systems? I probably don't need to tell any of you what you feel when you're stressed, as we've all felt it at one time or another. But just to note here, the main symptoms people mention when they're feeling stressed are irritability and anger, fatigue or lack of motivation, feeling anxious, having headaches, and also having an upset stomach or indigestion. So for example, the upset stomach or indigestion relates to that decreased motility of our gut during times of stress. So moving on to the effects of stress, we're looking first at the acute effects of short-term stress. So while the effects of stress may feel negative, these systems evolve to be adaptive and beneficial to our survival in times of stress. And in the short term, they are. So short-term stress can have positive impacts on our functioning. A couple different things I'm going to highlight in this talk are upregulation of certain parts of our immune system and improved performance and memory. But I'm just going to do a quick aside first about the immune system to build a little bit of background info on what the immune system components are so that the effects of stress make a bit more sense. So there's two main players in our immune system. There's our innate immunity, shown here on the left, which is responsible for a rapid response, and our adaptive immunity, shown on the right, which is the slower response. So innate immunity is our general protection that we're born with. For example, our skin acting as a barrier, being able to fight off any things that might happen from cuts and scrapes, and mucus in our nose and our mouth that helps to prevent us from getting sick. And the adaptive response is immunity that develops throughout our lives as we gain exposure to certain things. And this is the idea that vaccines are built on. So for example, if you get vaccinated against a particular condition, your adaptive immune response learns from that and is able to, over time, build a response that allows you to fight that potential pathogen down the road. Okay, so looking back at stress here, now that we've got a little bit of background info, what does acute stress do to the immune system? Well, acute stress has been shown to upregulate our innate immunity, so that quick response that we're all born with, which has shown to be pretty energy efficient. And this is thought to help prepare our body for fighting infections from cuts, bite wounds, injury, etc., really based in kind of evolutionary theories when, years ago, if our fight or flight response system was based on, for example, meeting a bear or something like that in the woods, the immune system you really want to be firing on all cylinders is the innate immune system in case you do get bite wounds or any other injuries from this encounter. It's also shown to suppress our adaptive immune system. So that slower response that learns over time is a bit more energy consuming. So it makes sense in times of acute or short-term stress to kind of downplay that system and save your energy for something that's more beneficial to you. Next, looking at the effects of short-term stress on performance. So short-term stress has actually been shown to improve our performance, and this has been explained one way by the Yerkes-Dawson law, which describes that we reach optimal performance at certain levels of stress. So it's a bit like the Goldilocks scenario, where when we have too little stress or too little arousal, we become bored, not stimulated or motivated enough, and our performance lacks. If we have too much stress or arousal is too high, we can feel exhausted, we can kind of get in our heads and feel anxiety. And again, this doesn't lead to very good performance. Whereas when you have optimal arousal or stress, it's just enough to keep you focused, keep you motivated, and give you a little boost without tiring you out. There's also some adaptations to this theory as well. One of which says that as the task that you're doing increases in difficulty, the optimal performance happens with lower level of stress or arousal. So for example, if you're trying to do, let's say, complex math or writing a paper or something that takes a lot of brain power, you'd probably prefer to have no one talking to you or not having any music or sound in the background so that you can perform optimally. Whereas as a task becomes easier, optimal performance is found at slightly higher levels of stress or arousal. So for example, if you're doing the dishes or something, you probably enjoy talking to someone or listening to music, and that will make you kind of focused on what you're doing and keep you motivated to keep going. And finally, the last positive effect of acute stress that we're going to go through today is its impact on our memory. So it's been shown that limited levels of stress induce rapid memory formation. And this is thought to be related to that HPA axis signaling. So CRH, that hormone we've talked about, is released from the hypothalamus to act on the pituitary in order to start that cascade that leads to cortisol being released from the adrenal glands. But CRH has also been shown to act on other areas of the brain too, specifically areas involved in learning and memory. And this is thought to be the connection in how in times of short-term stress, our learning and memory is actually improved. Okay, so we're going to take a quick little break here, just for about 10 minutes, and I'll check any questions in the chat. And when we come back, we'll dive into the effects of chronic stress and what that does to the body. So we'll come back at 1:35. It again. So let's see, it looks like I've gone through and answered the questions I saw in the chat. Does anyone have any other questions they wanted to post in the chat or say over the microphone right now? Okay, so we will move on to the next part of the chat, which will be on chronic stress and the effects it has on the body. But first, we're going to do another poll just to re-engage ourselves after the break here. So which of the following body systems is or are impacted by chronic stress? The cardiovascular system, gastrointestinal system, immune system, or the nervous system, or all of the above? So let me get this poll going. Okay, and I'll just give about 10 more seconds to respond if you haven't already. Okay, so I'll end the poll here. Okay, it looks like everyone said all of the above, and that is correct. So chronic stress can affect many different parts of your body, including those systems we just talked about, as well as it can impact your risk for diabetes, obesity, and mental health conditions. So we'll talk about each of these throughout the next half of the talk here. So starting off with the immune system. So in contrast to some beneficial effects during acute stress, chronic stress can lead to global immunosuppression and some inflammation. So increasing this duration that you experience stress shifts that immune response from being adaptive to a little bit detrimental, with most immune cells being a little bit downregulated compared to people who don't experience chronic stress. And it's found that people who are living with diseases and other people who are older in age are a bit more susceptible to these negative immune changes in response to chronic stress. And most likely because the immune system is already loses a little bits of its regulation in states of disease and older age. So you're a bit more prone to experiencing these effects of chronic stress on the immune system. And as a result of immunosuppression and inflammation within the body due to chronic stress, certain important immune cells like T cells and natural killer cells that are important for destroying mutated cells that could eventually lead to cancer are also suppressed, which may in some instances increase one's susceptibility to certain cancers. Now, like we talked about before the break, the HPA axis, which is that slow response system to stress, can act widely throughout the brain. And while it can improve learning and memory in the short term, chronic stress and chronic activation of this HPA axis may drive some disease progression and impact our memory and cognition. So one of the diseases thought to be involved in this process is Alzheimer's disease, as it's been shown that chronic psychological stress is a risk factor for developing Alzheimer's. So shown here is a simplified model of this proposed theory. So what they're proposing is stress kind of leads to this activation of our HPA axis and our stress response system, which can drive some disease progression in the brain. And that disease progression can end up disrupting our stress circuits, which in turn lead to more dysfunction within the stress response system. So this is further supported by a condition called Cushing syndrome, which is a state of excess cortisol, which is that stress hormone. And it's seen in people who have pituitary tumors or exogenous or outside sources of steroids, which can lead to more cortisol in the body. And it's associated with atrophy or shrinking of the hippocampus, which is one part of the brain. And this shrinking of the hippocampus is seen in both conditions of chronic stress and Alzheimer's disease. So it's thought that that might be a bit of the connection there, but it's not fully understood yet. And this, again, like I said, is just one theory as to why chronic stress is a risk factor for Alzheimer's. Now, moving on to the cardiovascular system, epinephrine or adrenaline, which is released in response to stress, can cause heart rate and blood pressure to increase. And over time, this chronic increase in heart rate and our blood pressure can lead to high blood pressure or hypertension. Now, some of the health consequences of hypertension are damaging our blood vessel walls, leading to atherosclerosis or plaque buildup. And sometimes if the walls get weakened enough, that could predispose someone to an aneurysm or a bulge in the blood vessel. And severe hypertension over long periods of time can sometimes make the heart work a bit harder, which can lead to the heart walls responding by thickening or dilating so that they can withstand that pressure. And this can sometimes lead to heart failure in certain people. Now, there are many other consequences of long-term high blood pressure that's not controlled well. So I'm just touching on a couple here. But if you are interested in more detail on cardiovascular health, I did a previous talk on vascular disease that you could watch on Dr. Gair's website. And again, that link is in the email that you got the link for the Zoom today. Also, if you just Google Dr. Gair, will be the first thing that pops up. So more effects of chronic stress on the cardiovascular system is cortisol and the chronic low-grade inflammation that we experience during times of chronic stress can also contribute to the development of atherosclerosis or plaque in our blood vessels. And this can eventually lead to coronary artery disease if enough plaque builds up in the arteries that feed the heart muscles, which are called the coronary arteries. So this is just a little picture here of what a normal healthy blood vessel looks like. And then certain triggers can lead to the buildup of plaque, which narrow this inside of the blood vessel and restrict the amount of blood that can get to areas like the heart. And again, if you're interested in atherosclerosis at all, I go into it in a lot of detail in that vascular disease, talk about different things besides stress that can lead to inflammation and plaque buildup in our arteries. And lastly, another way chronic stress can impact our cardiovascular system isn't so much a direct act on the body, but how stress impacts our behavior. So stress can lead to unhealthy coping mechanisms like having a poor diet or smoking that can further contribute to heart disease. And again, things like smoking and poor diets can damage the walls of our arteries, leading to things like plaque in our arteries. And it can also contribute to other things like obesity and high blood pressure, which again contribute back to heart disease. So it's really kind of multifactorial things that feed back on each other that can kind of moderate the combination between stress and cardiovascular disease. And next, so while this that I'm going to talk about right now isn't an effect of chronic stress, I thought it's interesting to mention because it can follow extreme acute stress. Sometimes people can get something called broken heart syndrome or Takotsubo cardiomyopathy. So this exact mechanism of how this happens isn't really known very well, but it's thought that high levels of stress hormones from a really acute stressful event like the loss of a loved one can cause changes in the heart muscle cells, leading to weak heart walls and poor contraction of the heart. And in about 20% of people who get broken heart syndrome, 20% of them will experience heart failure, which is a chronic condition impacting our heart's function. And most people do end up recovering with no long-term damage, which is the good thing. But it is really rare that someone may die from this condition, which I thought was kind of interesting because it means technically you can die from a broken heart. But to note here, your heart doesn't actually break like in this little picture. It just weakens in response to stress hormones. But this often happens following a major event like a loss of a loved one, ergo the name broken heart syndrome. Okay, so back to the effects of chronic stress. Another one is diabetes. So while stress alone doesn't cause diabetes, it's thought to play a role in the development for some people. So it's been shown that moderate to high levels of stress are associated with a 2.3-fold increase in the odds of diabetes when measured 3 years later in an Australian longitudinal study looking at specifically women's health. Now, just a quick refresher on diabetes. I have a little picture here demonstrating it. Our pancreas, which is a little organ in our abdomen, has things called beta cells shown here, and they secrete the hormone insulin. And insulin's effect is to lower our blood glucose by allowing glucose or sugar from the blood to enter into the cells so that it can be used as energy. Now in diabetes, insulin doesn't work properly, and so glucose cannot enter into the cells, and it ends up staying in the blood, which means you have high blood glucose or high blood sugar. And just another little shameless self-promotion here. If you're interested in learning more about diabetes, I did a talk on specifically diabetes a little while back, and it's also on Dr. Gair's website. So if you think back to the actions of cortisol that we've discussed, one of them was to increase our blood glucose so that our body has the energy we need when facing whatever the stressor is. So this is opposite of the action of insulin, which should take up glucose into the cells and lower blood glucose. It's also thought that cortisol may go one step further and actually impact the insulin producing cells, those beta cells themselves, by contributing to insulin resistance, meaning they will no longer respond to triggers telling them to release insulin into the blood. So this is seen in a condition called Cushing disease, which I mentioned a little bit earlier, where a tumor might grow in the pituitary gland, leading to high levels of cortisol being secreted continuously. And one of the long-term risks of Cushing disease is diabetes. So that just kind of shows the link here and why the thought is that chronic stress and cortisol can contribute to diabetes. And if you notice in this little picture here, one of the effects of cortisol is visceral obesity, shown in the bottom. So that brings us to our next point of obesity. So in chronically stressed individuals, both behavioral and cellular mechanisms promote obesity or the storage of fat in our body and other metabolic changes. So a couple ways it does this: cortisol can increase your appetite, and it specifically makes you crave energy-dense foods. So things that are high in fat and carbs. And this is probably why we refer to things like mac and cheese as comfort food, because it's what we crave during times of stress. It's what our body actually signals us to replenish our stores with, some really energy-dense food. Cortisol also contributes to specifically central obesity or fat around our belly, but the fat it promotes is actually deep fat or visceral fat. And this is fat that sits around your organs and can increase the risk of developing chronic diseases like heart disease and diabetes. And another way stress impacts our weight is mediated through sleep. So we all know that when we're feeling stressed, we often have problems sleeping, whether that means you're not able to fall asleep since your mind is racing and you're kind of stimulated by all these actions that stress is having on your body, or you may wake up throughout the night having a restless sleep. And a variety of studies in both adults and children have shown that sleep durations, the amount of time that we sleep per night, is inversely associated with obesity, meaning that people who have worse sleep or shorter lengths of sleep are associated with having more body weight or more fat stores. And the opposite has been shown to be related as well. So people who have better sleep are shown to have less obesity and less fat stores. Let's see. Oh, and it's also been shown that hormones that regulate our appetite, so how hungry we are and what we crave, are also influenced by sleep. And I'm sure most of us have experienced this too. So when you're really tired, you may just be craving not so healthy foods. And this is another way that stress and sleep can help contribute to obesity and fat store in our body. So I really like this diagram. It's from a paper in the journal Metabolism, and it points out how interlinked the effects of stress are on cardiovascular disease and diabetes and obesity, because they're all driven by shared pathways. So stress leading to behaviors here, shown on the left, interact with the hormones and other cellular signals shown here on the right, like the HPA axis and the sympathetic nervous system. And they can both kind of interact and contribute to various health consequences like diabetes and weight gain and heart disease. So it's not just kind of in isolation that these effects happen. They're often quite shared. And that's why you often see lots of these effects, not necessarily due to stress, but someone who has obesity may also have diabetes and heart disease, and vice versa. They're quite linked in the mechanisms in which ways these diseases evolve. So moving on now to the gastrointestinal system, you may have heard of the gut-brain axis before, and it's composed of interconnected bidirectional pathways between the brain and the gut that's been shown to be modulated or altered by stress. So our gut is controlled automatically by the autonomic nervous system, one part of which is the sympathetic nervous system that we've been talking about. And this connection can alter the motility of our gut or the natural rhythmic contractions that move food through our gut. And so in combination with the HPA axis shown here and the sympathetic nervous system shown here, they seem to modulate our immune system within our gut, including the gut microbiota shown here, which can have greater impacts on our broader health. And some strong links between stress and gut health are also found when looking at functional gastrointestinal disorders like irritable bowel syndrome. So irritable bowel syndrome, or IBS, and psychological distress, often in the form of anxiety or depression, have been shown to occur together quite often. Studies have found that about 40 to 60% of the time, these two conditions occur together. And some studies suggest that up to even 80% of the time, people who experience IBS may also experience stress-related disorders like anxiety. And it's been found that people often experience a significant increase in their stressor score or their level of stress just before they start developing IBS. And as well, people with IBS often report stress as a trigger for their symptoms to flare up. Even people without IBS can experience this gut-brain axis connection at work, as during times of stress, many people experience changes in their bowel movements, often tending towards diarrhea when they're acutely stressed. And finally, another little link to point out here, functional gastrointestinal disorders like IBS are sometimes treated by using things that are otherwise used to treat mental health and stress disorders as a way to impact the gut-brain axis. So for example, some anti-anxiety or antidepressant medications have been shown to benefit IBS symptoms, and psychological therapy like cognitive behavioral therapy has also been shown to help people with IBS manage their symptoms. So lots of links between the brain and the gut going both ways, and stress seems to play an important role in those connections and what actually happens. So speaking of all those mental health concerns, we'll move on to mental health now. So the terms stress and anxiety are often interchanged in our day-to-day speaking, but there is a difference between them. So generally, stress is a response to an external cause, like the four we talked about at the start, the NUTS acronym: novelty, unpredictability, threat to our ego, and loss of sense of control. Whereas anxiety is a person's specific reaction to stress. So its origin is internal. And anxiety is typically characterized by persistent feelings of apprehension or dread. And in situations, you have these feelings in situations that are not actually threatening. So unlike stress, anxiety persists even after the stressful concern or situation has passed. And in more severe cases, anxiety can escalate into an anxiety disorder. So the connection between stress and anxiety that it's been shown, is that it's been shown in prolonged exposure to stress hormones can contribute to the development of anxiety and an anxiety disorder. So this is why anxiety and stress often share many of the same symptoms, like racing heart, sleep problems, headaches, tight muscles, fatigue, feeling on edge. All those are commonly experienced in both stress and anxiety. But when anxiety gets bad enough after experiencing long-term stress, it may also have symptoms including persistent intrusive thoughts, unrelenting feelings of worry or fear, even when the stressful situation is no longer around, or even panic attacks. So the next type of mental health condition I'll talk about is PTSD, which is a disorder related to anxiety disorders, and it's characterized by intrusive thoughts, nightmares and flashbacks of past traumatic events, and avoidance of reminders of that trauma, hypervigilance, and sleep disturbance. So it occurs following the experience of a traumatic event like a car crash, war, sexual assault, or natural disaster in about 5 to 10% of people who experience those traumatic events. So while the underlying cause of PTSD isn't very clear right now, it's thought to be related to dysregulation of that HPA axis, or the slow response stress system. And some studies have found that increasing levels of CRH, that initial hormone in the HPA axis cascade, so increased level of CRH in people with PTSD has been found, which then would go on to increase activation of the HPA axis and stress response. And other studies have found that in people with PTSD, they have a reduction in the size of their hippocampus, which is the area in the brain that releases CRH, and is involved in other areas of emotional regulation. So while we don't really know what these changes mean specifically, we don't know if these changes are what made those 5 to 10% of people more susceptible to developing PTSD, or if they're the outcomes of the disorder. So it's kind of the chicken and egg, we don't know yet, but it is evident at least that PTSD does involve changes in neuronal and hormonal signaling within the body, and is a result of extremely stressful situations. Next up is depression, which has been shown to have strong links with chronic or toxic stress. And again, it's a combination of behavioral and biological pathways that's thought to stimulate the development of depression following stress. So for example, if you're having difficulty coping with chronic stress, one might become overwhelmed, have negative changes in their mood, have sleep troubles, reduction in your self-care and physical activities, and even have relationships start to suffer. So these behavioral changes following stress, in combination with those neuroendocrine or hormonal changes that we already know about, including disruption of the HPA axis, can increase the risk of mental health disorders like depression. So again, it's this combination of behavioral outcomes of stress and biologic or chemical changes in our body in response to stress that are thought to contribute to the increased risk of depression among chronically stressed individuals. So another poll here, just to wake everyone up after that vast amount of info I just shared. Do you think it's true or false that stressful or traumatic experiences in childhood can lead to long-term health consequences? So let me initiate this poll. Okay, so you think it's true or false that stressful or traumatic experiences in childhood can lead to long-term health consequences?
True.
Okay, so there's 5 more seconds here to answer. All right, so I'll end the poll here. So you're all on the same page. You all said true, which is the correct response. So there's something called adverse childhood experiences, or ACEs, which include things like abuse, neglect, or household dysfunction. So there's different things in each category. For example, abuse can be physical, emotional, sexual. Neglect can be physical or emotional. And household dysfunction for the purpose of ACEs has been defined as either mental illness in the house, having an incarcerated relative, having your mother treated violently, substance abuse, or divorce. And ACEs are really common, with up to 64% of adults having experienced at least one ACE. And why these matter is that it's been shown that the higher number of ACEs one has leads to the higher their risk of health problems down the road. And now I put a little asterisk here because the score and kind of the relative risk of the number of ACEs that you have to your risk of health consequences doesn't take into account any positive supports or experiences that you had that could help to mitigate some of those potentially negative effects of their ACEs and build resilience. So for example, if you have a grandparent growing up who loves you, even if you have maybe dysfunctional parents, or you have a friend to confide in during any sort of stressful experience you have in childhood, that can really help to mitigate long-term effects of early trauma. And also to note, the kind of ACEs risk score doesn't take into account someone's genetic risk or any other important lifestyle factors that may contribute to certain conditions down the road, like their diet or activity. But with all that being said, ACEs have been shown to have some predictive value for certain health outcomes, and health professionals even have ACE risk assessments that they can do to help get a greater picture of what their patients' social and emotional experiences have been in order to best serve them while acknowledging the traumas they may have experienced. So ACEs have been shown to lead to toxic stress and increase the risk of negative behaviors shown at the top here, like smoking, alcoholism, low physical activity, plus physical or mental health issues shown on the bottom, like obesity, diabetes, depression, heart disease, etc. So the first study was done on ACEs back in 1998, and it found that for someone with 4 or more ACEs, so if I go back here for a second, so having 4 or more of these 10 kind of subcategories, they have a 3.9 higher risk of lung disease, 2.2 times higher risk of heart disease, 1.9 times higher risk of any cancer, and a 1.6 times higher risk of diabetes than someone with 0 ACEs in their whole lifetime. So these increased risk of chronic health problems is thought to be due to the interaction between behaviors, at the top here, like smoking and drug use, lack of physical activity, that are more common in those with higher ACE scores, and the toxic stress abuse creates within the body, disrupting the neuronal circuits and hormones that we've been talking about, like the sympathetic nervous system and HPA axis, as well as reducing immune functioning and subsequently increasing inflammation in the body. So again, just showing that the outcomes of stress really are these kind of multifactorial things leading to consequences down the road. It's never just one thing in isolation. It's how these all interact throughout your life, including genetics, experiences, behaviors, etc. So with that all being said, I realize this talk has generally been pretty negative. I wanted to make a note here of when to seek help, because it's really important to reach out for help when you need it, whether it be a difficult or abusive situation you're in, or just general day-to-day stress that's been building up over time and leading you to feel overwhelmed. Talking with a healthcare professional or even a loved one can be beneficial to your health and help mitigate any potential negative downstream effects of stress. So some ideas of when to seek help are if you're feeling overwhelmed, if you're feeling worried about your level of stress and or its impacts on your health, if you start using drugs or alcohol to cope, and if you have thoughts of hurting yourself. It's really important for any of those reasons or anything else if you just generally want to speak to someone about stress. I'd really recommend reaching out to your primary care provider or a mental health provider like a counselor or therapist, or even a crisis line, because talking is really helpful, and then maybe you can make personalized strategies to help you moving forward. And I will have some resources at the very end of the talk in a couple minutes here. So this is a little preview of my talk for next week, which will be on stress management, because again, I didn't really want to end on such a heavy note. I thought I'd wrap up by going briefly over some positive ways to manage stress. And again, you can tune in next week if you want to know more information about it. So different forms of self-care are great for stress relief, although they're often the first things that go when we're feeling stressed. Self-care and kind of doing strategies like physical activity and relaxation strategies, they're often the first thing that we stop doing when we're stressed. But things like relaxation activities like meditation and yoga, or exercise, or even just getting outside, eating well, trying to improve sleep hygiene, those are all really great ways to help relieve stress in the moment. Other things like positive attitude, gratitude and acceptance, and reframing even can help you feel a bit more in control of the situation, which can help to reduce the impact the stressor can have on your life. So another part of acceptance would be sitting down to identify what it is exactly that's stressing you out. And if it's something that you can partially control, then trying to set some goals to make solutions to work around that. So problem solving can be a source of stress management. And finally, social connection and talking about it, whether that's venting to friends and family or talking to a healthcare professional, discussing what you've experienced and sharing experiences and connections with others are a great way to reduce the impact stress can have on your life. And again, I know lots of people try strategies like this all the time and don't find much relief. So if you are trying to kind of manage stress on your own and aren't seeing a benefit, I'd really recommend talking to a professional who might be able to make a tailored strategy or action plan for you, which may include medications or some more behavioral or psychological strategies. So to finish off here, I have some suggested resources. So the Center for Studies on Human Stress was that Canadian organization I mentioned that came up with the NUTS theory, the novelty, unpredictability, etc. So that can be found at this site here. And again, these slides will be posted, so you'll be able to access the links through here online. The Canadian Mental Health Association is also a great resource if you wanted to learn more about mental health and stress. Crisis Line Association of BC, if you wanted to speak to a professional or have someone to talk to. They also, you can go on this website to find some information and resources. They also have this 24/7 mental health support line, and it looks like a weird number, but they say no area code is needed, so just 310-6789, and you can speak to someone for just general mental health support. There's also HealthLink BC. They have a whole section on stress management with lots of different ideas and resources linked within that page. So I'd recommend checking that out if you want to find ways that you might not have tried to manage stress. As always, you can telephone 811 or 711 for hearing impaired to speak to a registered nurse or dietitian, an exercise professional or pharmacist if you want some more specific advice on how to manage your own stress and lifestyle. And there's a book here that Dr. Gair recommended. It's called Burnout, The Secret to Unlocking the Stress Cycle. And it's by two sisters with the last name Nagoski. And apparently it's a really insightful book. And they also do a TED Talk, which you should be able to find online if you look up their names, Nagoski there. And again, this will be posted online, so you'll have access to the resources. Okay, so we'll stop there and see if anyone has any questions.
Nicole, one of the burning question is that in all these affluent society, technological, well-developed societies, there is tendency for all sorts of stresses, And number one is the family breakdown, about 30 to 40% divorce rates. So it has a generational effect, on the family too. So is there any attempt to correct such kind of endemic situation problems?
Yeah, that's a good question. I don't actually know because I didn't research that too much for the talk, but I do know what you're saying. There are those epigenetic effects or kind of multi-generational effects of trauma and stress that can be kind of passed down through family members. I'm not sure what strategies there are for kind of mitigating that, but yeah, I don't know, but that's a really good question. Yeah, I wonder if Dr. Gair is here. If she doesn't look like she's here, but that might be a question that Dr. Gair might have some answers to, being a genetics person.
Okay. Is she there?
I don't think she's here right now, no, but we could maybe send her an email after if
okay.
Yeah.
She recommended this book by Nagoski. What is the name of the book?
Yeah, I put it back up on the screen here. So it's called Burnout, The Secret to Unlocking the Stress Cycle.
Okay, thank you.
You're welcome.
I can find it in the library, yeah? Library?
Yeah, possibly. You might be able to find it in the library. I'd maybe call and ask.
Okay, thank you.
Let me just check the chat here a bit fast. Apologies for going a bit fast on the talk. Hopefully you'll be able to access the recording and the slides after to catch up on some information I may have gone quick through.
Yes. So, how the impact of yoga, meditation, and vegan diet, and the reduction of stress? Do you have some scientific reason, data?
I don't yet, but I'm currently making the talk for next week on the kind of science and research behind different management strategies.
Okay.
So if you're interested, you can come to that one. I'm planning to kind of talk about a bunch of different common management strategies, and if there's any research behind them, what that research shows.
Yeah. And what is the effect of these brain transmitters, like all these brain transmitters that we get into our brain, serotonin, dopamine, and all those things? Does this in this stress and anxiety, do they affect those levels too, the neurotransmitters?
I believe they do. I didn't look into that too much because that would have been like a lot for this talk to go through, but I believe there are other neurotransmitters that are impacted by stress, like dopamine, like you mentioned as well. Yeah, but I don't know the actual impacts and how they are impacted though.
Thank you.
You're welcome. All right. So if there aren't any other questions, we'll end the talk here. Just a thank you to Dr. Gair, who's our supervisor, and my classmates, Julia and Drew, who will be delivering future talks in the series here. And like I mentioned, we'll have a talk next week on stress management strategies and what the research there is behind those, if any.
Yeah. So guys, before you go, can you summarize and tell us now what are the 4 or 5 criteria that we should practice to avoid anxiety, worry, and stress, anxiety, on our health? Can you give us 1, 2, 3, 4, 5 points now? Like yoga, meditation, some good balanced nutrition, exercise, and how about genetics? No, does genetics also have some impact on this anxiety and depression?
Yeah, I think it has been shown that there is some sort of genetic component to how we respond to stress and how different stress management strategies may help us out. I don't know exactly what that connection is though. But as far as general strategies, it's hard to list a top 4 because everyone's really different. So someone might find exercise super helpful and other people might just not enjoy it at all. But generally, some sort of physical movement and getting outside is helpful for our mental health. And then
Positive attitude, gratitude. I mean, all these points that you have put it there: relaxation, exercise, eating, positive attitude, gratitude, acceptance, reframing. What is acceptance and reframing? What do you mean by that?
So there's certain things that show that kind of accepting certain situations might be out of your control can sometimes release the burden on yourself if it feels like it's a really stressful situation. Realizing that, this isn't something that I can control can actually be relieving sometimes.
Okay.
Because it kind of takes that out of your hands. And reframing is similar, just kind of reframing, either trying to put a positive spin on things or just reframing it to be something that is not a problem that you created or have control over, and kind of letting it go in that way. But yeah, these are all, some people might love this, some people might not. So it's very personal. It's hard to kind of say.
Okay. The final question. I've just read that it's a good idea to eat together in a family. That promotes better health and reduces the stress. Is there any scientific reason for that? Eating with the family and in a group rather than eating alone?
Yeah, there is. I know there's some research behind it. I can't remember what it is specifically, but if you go to the Canada Food Guide, that's one of their new recommendations. And I think they actually cite their sources within that. So if you look up the Canada Food Guide, you might be able to find the science behind that, because it has been shown to have benefits to our health and our well-being to eat socially rather than on our own.
Okay, thank you.
You're welcome. Okay, so we will end the talk here. Thank you everyone for coming, and hopefully I'll see you next week for a bit of a follow-up on this talk on some science behind different stress management strategies.
Yeah, can this talk, your Zoom can be seen in America or maybe India or some other countries, or is it localized to Victoria?
You mean Zooming, like people who can come to the talks?
Yeah, I mean, supposing if somebody wants to hear this talk in Ottawa, Toronto.
Yep, you can send, when we send the email out, you can just forward that email to anyone else who might want to come to the talk.
Okay, they can hear anywhere. Thank you.
You're welcome. Okay, so we'll stop the talk there, and we'll maybe see some of you next week.